cancer screening protocols which are in way now. What all cancers should be screened and what are the most common cancers. We know that between the age of 20 to 80 years, 50% of the people even now die with coronary artery disease or heart attack. But 30% of mortality nowadays occurs due to cancer. Remaining 20% occurs due to infection, tuberculosis, malaria, HIV, other pneumonia and other infections, and liver disease, kidney failure. So 10 people dying between the age of 20 to 80 years, 5 out of 10 die of heart attack, 3 out of 10 is dying of cancers nowadays. And what are the most common cancers that we encounter in the clinical practice? The most common cancer that is seen throughout the world in males and females put together is female cancer or CA breast. So breast cancer is on a rise in females, and now some statistics say that 1 in 3,000 men are also having increased chance of breast cancer. Previously, we used to screen for breast cancer only in people above 40 years or ladies above 45-50 years. Now the guidelines are changing. There is no strict age division for screening for breast cancer. You can screen for breast cancer in a young girl 15 years or a middle-aged lady 30-40 years or elderly lady of 60 or 70 years. To how to screen for breast cancer, it is by a test known as mammography. So mammography just means that it is an imaging of the breast is known as mammography. You can do an ultrasound mammography, an X-ray mammography, and now more sensitive test is thought to be MRI breast, that is known as MR mammography. Because we know that 80% of breast is made up of fat and connective tissue. Some ladies, fat in the breast is less, but connective tissue or fibrous tissue is more. That is why when you do ultrasound, they comment as dense breast. So in dense breast, many times MR mammography is much more sensitive. And always understand, 50% of breast cancer occurs in ladies less than 40 years nowadays, and remaining 50% only occurs in elderly people more than 40 years. So don't think that a young girl 25-30 years are not at risk of breast cancer. You have to screen for breast cancer annually with an ultrasound breast or an X-ray mammography, or in people with a dense breast with an MR mammography per se. And what are the risk factors of breast cancer? One of the most important risk factors is the family history. Your brother, sister, mother, anyone, even father, mother, brother, sister, male or female, any relative having any risk of any other cancer, or your sister, mother having increased risk of breast cancer per se. So suppose you are having a family history of cancer in your family, your father, mother, brother, sister, anyone having any other cancer in the body, not only breast cancer, you have a high risk of having breast cancer. What are the genes or genetic study to rule out the genetic factors for breast cancer? There are 2 gene mutations, BRCA1, that is BRCA1 and BRCA2 mutation. Suppose you are any of the first relatives is having a breast cancer, you want to find out you are having an increased risk, you are doing ultrasound or MR mammography, it is normal, you go to a lab and do for a genetic test of a BRCA1, BRCA2. So BRCA1, BRCA2 positive, your chance of increased chance of breast cancer is there. There you can meet a surgeon and go for a risk reduction or a risk reduction mastectomy or an RRM if you require that. Just understand, screening for breast cancer is not age dependent, you can do at any age. Second most common cancer seen throughout the world is lung cancer. Previously we used to think that lung cancer occurs only in smokers. Now we know that 50% of lung cancer people are only smokers. Remaining 50% have genetic predisposition to lung cancer. Some have asbestos exposure, some have air pollution, some have alcohol, some have family history. So don't think that all the lung cancer patients are smokers. Only 50% of lung cancer patients are smokers. And why does lung cancer have a high mortality? Why do people with lung cancer die much more rarely within 2 to 3 years? Because lung cancer is diagnosed very, very late. People don't have symptom in 50%. 50% people go on with coughing, 50% have tiredness or some pain in chest where they attribute it to allergy or any environmental pollution or asthma per se. So many of the lung cancer has missed. Now the recommendation is that every person aged more than 50 years should screen with a low intensity or low radiation exposure CT scan test once in 1 to 3 years. So lung cancer should not be missed. Most common cancer that we have to screen in a female is always CA breast. Second most common cancer in male and female throughout the world is a CA lung. 50% of lung cancer people are only smokers, 50% are non-smokers. So age more than 50 years, once in 1 to 3 years, ask for a CT scan test to pick up a lung cancer. Third most common cancer encountered throughout the world is CA colon or your colonic malignancy. So colonic malignancy guidelines has become more prominent nowadays. Age more than 45 years, male, female, everyone should do a colonoscopy once in 5 years. So age more than 45 years, suppose your father, mother, brother, sister is having a history of CA colon, age more than 20 years itself, you should do a colonoscopy. What's the importance of doing a colonoscopy? Because colon cancers always originate from polyps. So once you are doing a colonoscopy, you find out a polyp and the doctor removes the polyp, the chance of colon cancer comes down by 80%. So understand, cancer means a cancer. People don't die of cancer because an organ is involved. In cancer, people die because the organ, the cancer is there, but it spreads to other parts in the body. That's why breast cancer lady doesn't die of breast cancer. They die because breast cancer has spread to your brain, lungs, kidney, other organs and bones in the body. So early detection means early cure. So you can screen for breast cancer, CT scan chest. For lung cancer should be done in every person age more than 50 within 1 to 3 years frequency. So age more than 50, 1 to 3 years, you have to do a CT scan chest. Colonoscopy once in 5 years, age more than 45 years. Any polyp that gastroenterologist will remove, age more than 20 years with any person with a family history of CA colon. Fourth most common cancer that we encounter is CA prostate. Prostate cancer is the most common cancer that is nowadays seen in elderly men more than 40 to 50 years. The universal screening for prostatic cancer is with PSA, prostate specific antigen. Whenever you find a PSA more than 4 nanogram per ml, go to a urologist, go for a prostatic biopsy, or nowadays MRI prostate is done with contrast, that is known as spiroid screening. So MRI is thought to be equally sensitive compared to a prostatic biopsy. But don't think that every PSA high is a prostatic cancer. PSA is prostate specific, not prostate cancer specific. But whenever you find a PSA more than 4, go to a urologist, evaluate for a prostatic cancer by biopsy or an MRI prostate. So now we are discussing the 4 most common cancers on earth that is seen. Number 1 is CA breast, second is CA lung, third is CA colon, fourth is CA prostate, fifth is CA cervix. Cervical cancer in females is on the rise because cervical cancer is a vaccine preventable cancer. 99% of cervical cancer is due to human papilloma virus. Nowadays, school-going children less than 16 years are getting HPV vaccination. But other population nowadays above 25 years have not been exposed to HPV vaccination. So age more than 30 years, every female once in 5 years has to go for a pap smear. You have to go for a cervical smear, that's a pap smear with a HPV DNA checking. So the 5th cancer that we are discussing is a CA cervix, and the 6th cancer that's in the order of frequency is CA pancreas. Cancer pancreas is on rise. There is no international recommendation scheme for pancreatic cancer, but in people with a high risk of pancreatic cancer, especially smoking, alcohol, history of a fibrocalculus pancreatic diabetes, or family history of any other cancer, if you want to screen for a pancreatic cancer, you can go for a CT scan abdomen. So now cutting short, the cancers which are screened by international recommendation, number 1 is cancer breast, number 2nd is CA lung, number 3rd is CA colon, number 4th is CA prostate by PSA, number 5th is CA cervix, number 6th is CA pancreas, no international recommendation, but if the risk factor, you can go for a CT scan abdomen to pick up a pancreatic cancer. What's the importance of screening? I told you, early detection means early cure. You are finding up a colonic polyp and your polyp is going to be a cancer after 5 to 10 years. Your age is 45. You do a colonoscopy, remove the polyp. You are free of cancer after 10 to 15 years. You are having a breast CA sitting just behind the nipple 2 cm, where you are doing a PET scan, where your body does not spread. You just have a mastectomy and remove that and your cancer is totally cured. Whereas you are developing a breast cancer at 40, you are diagnosing at 45 years, it spreads to all of the body, then there is no use at all. Suppose you are a recurrent cough, you are coughing, you are thinking that it's your chikungunya, viral fever, allergy, you are having coughing, ultimately it's a lung cancer sitting there, you take a CT, the lung cancer is spread everywhere, the malignancy, lung spreads like anything, so we have to screen for a CT scan chest for a carcinoma lung in any person above the age of 50 years. And what about tumor markers? Nowadays you go to lab, they look at the blood markers for cancer pickup. The 5 commonly used tumor markers, number 1 is AFP, that is alpha fetoprotein. That's a tumor marker for carcinoma of liver and sometimes testicular tumors. Second is carcinoembryonic antigen, CEA. That is thought to be the tumor marker for a CA colon. And third is CA 19.9. That is a tumor marker for CA pancreas. Fourth we know is universal tumor marker PSA, that is for prostate. The only universal tumor marker that is accepted, that's a specificity to prostate, is PSA. AFP you may do to pick up a hepatocellular carcinoma or look at the prognosis. CA you may do to pick up a CA colon or look at the prognosis. CA 19.9 is good marker for a CA pancreas that is sitting, and the carcinoma of the ovary, the marker is CA 125. Blood markers are there, but more than blood markers, the most important blood marker recommended is PSA. It is imaging, which is important for all the cancers. Imaging for a breast by ultrasound, MRI breast, MR mammogram, 97% sensitivity, or an X-ray mammogram, father, mother, anyone having cancers in the family, you have to check for breast cancer risk. Always risk for the tumor gene markers, that's BRCA1, BRCA2 mutation. Second, CT scan lung, above the age of 50 years, once in 1 to 3 years. Colonoscopy, age more than 45 years, once in 5 years, mandatory. PSA, age more than 40 years, once in a year. CS cervix, every lady age more than 30 years, once in 5 years, go to gynae, do a pap smear, and see a pancreas if you have risk factor. Always find it out early and treat early. Early detection means early cure. That is your cancer treatment, and that is the importance of screening for cancers. Thank you.